How do we appropriately triage an athlete that sustains a head injury? LSU's last year POA suffered a scary head injury on Saturday night, and I think there's a lot to be learned about how she was triaged on the court, how to do a good primary assessment after a patient suffers this type of injury. If we go through a play-by-play, you can see where POA is attempting to accept the charge and then strikes her head on the back of the court and then clinches her head. Teammates on the court immediately run to her attention, and then this is sped up a little bit, but then they attempt to lift her up off of the court. An athletic trainer comes immediately to help them. You can see at this point she's having a hard time with her balance, and then a couple of more athletic trainers and the coach come to assist. They then attempt to try to basically carry her off of the court, and she essentially collapses at the three-point line, and they lay her down. I think at this point they realize the gravity of the situation, and you can see that one of the trainers goes to her head to stabilize her cervical spine. A hard cervical collar is then placed, and the stretcher is then asked to come out on the court as they log roll her onto a backboard and then subsequently transfer her onto the stretcher, where she is then taken off to the hospital. It's really easy for me to be the backseat driver here, but I do think that there's a lot of learning that can be had from this video, and by no means am I criticizing any actions of the athletes or the athletic trainers in this video. I think it's extremely important for anyone to know what to do in this type of situation, whether it be another athlete, an athletic trainer, or anybody in the stands, because this situation may come up at any time. If you witness a person that sustains a head or neck injury, it is of utmost importance to not move that patient. If you suspect a spine injury, you want to ensure that you keep that patient's head and neck in neutral alignment. If you suspect a concussion, you want to assess their mental status. There is an easy evaluation called the SAC, or Standard Assessment for Concussion, that can be performed. And remember that this is only a sideline screening tool. It measures 5 cognitive functions that may be impaired by a concussion, including orientation, like what is today's date and what is the time. Immediate memory is tested by asking them to repeat words. Neurological function is self-explanatory, in which you perform a neurological evaluation. Concentration usually involves having someone recite something in reverse order, like the months of the year, for example. Then delayed recall is where you will tell somebody 5 words and then come back about 5 minutes later and ask them to repeat those words. This is only an assessment tool that can help us triage patients that may have sustained a concussion, and it is no substitute for a medical evaluation. Remember to stabilize those patients immediately. Do not move them until formal medical evaluation can be performed. Reportedly, all POA CT scans came back negative, and she was treated and released at the hospital with a diagnosis of a concussion. I wish her a speedy recovery, and I hope that you guys learned something from this video.